this channel once again. The name still remains Thomas Ejebu. In our previous video about joint mobilization, we got to know a lot of things about joint mobilization, and I told you clearly that knowing those things will help you to be able to give an effective joint mobilization. And today we are going to continue with the same topic, and so this is part 2 of the joint mobilization that we talked about. Today we are going to talk about traction. We will also talk about gliding, and then when we say component motion, what does it mean when it comes to joint mobilization? And then we'll finally talk about some 2 specific types of joints that we need to know when it comes to joint mobilization. All these will help us to be able to give effective joint mobilization to our patients all the time. And so let's do this together. Alright, you are welcome to the show. So let's begin right away. I'll first talk about traction. When we say traction, what does it mean? In our previous video, I told you that traction and distraction are almost the same. They are all talking about trying to pull apart something. And in this case, we are talking about joints. So if you pull apart the joints, it means you are either tracting or distracting. But the only difference is that when it comes to distraction, we pull apart the joints so that the part that is pulled away forms a perpendicular angle with the treatment plane. But when we say traction on the other hand means that we pull apart that thing in any other angle apart from 90 degrees. So I can choose to tract downwards this way. I can choose to tract upwards this way. You understand? So it does not necessarily mean I should mandatorily pull away so that this bone forms a perpendicular angle with the treatment plane. That's what traction is trying to talk about. Let's move on to gliding. Gliding is also a manual technique. When we say you are gliding the joints, we are still using this as an example. So this is the humeral head and this is the glenoid fossa. So we have the joint this way. When we glide, it means that a point on an articular surface gets into contact with a series of points on the other articular surface. So this is the glenoid fossa. We assume that it has some points on it, and this is the humeral head. It has some points on it. When we are gliding, it means that a specific point on this humeral head gets into contact with a series of points on the glenoid fossa. So let's assume that we have a point here. When we are gliding, it means that this point will contact series of points on the glenoid fossa this way. So this is gliding. This is gliding. You understand? Yes, this is gliding. This is gliding. So a typical example is let's assume that you are driving on a stony grounds whereby you step on the brake. What happens is the car tire glides on the ground, isn't it? The car tire glides on the ground, and you have to know that there is a specific point on the tire that glides on the ground. The car does not, the tire does not roll. Understand? So that can be used as an example to broaden your understanding about gliding. Alright, so finally let me talk about component motion, and we'll end by knowing the 2 types of joints I spoke about. So when we say component motion is simply movements that associate with physiological movements which are not under voluntary control. For example, when we flex the shoulder joint, we are likely to have the humeral head roll in external rotation. Okay, so it means that when we flex the shoulder joint, we also have an associate motion, that is external or lateral rotation, accompanying it, and that is what is meant by component motion. It means that there are some movements that when we perform, we get other associate movements, which gives us an idea as to what to do. In terms, we have some of these movements very limited due to pain. What can we do to be able to indirectly get some of these movements also incorporated? You understand? So in case you have limited external rotation due to pain, then you can still perform flexion if there is reduced pain in that room, so that you can still get the external rotation that you want to achieve, but due to pain you are not able to do. You understand? So that is the importance of component motion to you when it comes to joint mobilization. Now, with the two types of joints, we have ovoid joints and sellar joints. With the ovoid joint is talking about a joint that one of the articular surface has a convex surface and the other has a concave surface. So you can find the image on the screen. You can see glenohumeral joint is an example. You can also use the hip joint as an example, and some other joints that also have the same characteristic. Now, the sellar joint is also talking about a joint with one of the articular surface having convex and concave surface, with an opposing articular surface having concave and convex surface. We can see some of these joints in the metacarpophalangeal joints, or let's say the hands, the joints of the hand and the joints of the feet. You understand? So basically, this is what you have to know about joint mobilization, and so let's always keep close to this channel all the time.
Hi, and thank you for listening.